So what mental health awareness means to me is I think it really gives us a chance as a community to lift women and birthing people up for the important physical and emotional work that they do. And I really like to take a socio-ecological approach to thinking of this. So, of course, that means supporting women and birthing people's self-advocacy and autonomy. But we also need to recognize that women and birthing people live in families and in communities and in this larger society. And we need to work at all levels to improve maternal well-being. I think what's at stake here is really huge, because our community's future health depends on fostering the potential of the children who are growing up here now. And we know that experiences from the moment of birth set the foundation for lifelong health and well-being. And it's positive responsive relationships between a child right from the moment of birth and a caregiver in the family or in the community that literally build strong brain architecture. And it's that strong brain architecture that means that the future brain skills are well developed, and then kids and adults, that developmental process starts in early childhood, continues through adolescent, continues in adulthood, and that's what really enables people to be, well functioning with strong, good mental function in adulthood. So it's a lifelong process, starts very early. And so if you consider how important that primary caregiver role is for a newborn and an infant, then you can see how important it is that those people who are taking care of our newborns really, that they have what they need. They feel supported. They have the skills that they need to be effective. They have the resources to reduce stress in their lives. And I think, here in Frederick County, one of the things that we've learned is we did a public survey in 2021 of about 4,000 people residents responded, and then we did focus groups. And through that public survey and through our focus groups, we could see how stressed families are. And this is especially true for families with 3 or more children. And they face all kinds of challenges in meeting their basic needs for housing, food, transportation, and childcare. And those things are really the foundations for, having good health. It's not just about health care or mental health access, but it's really making sure that people in our community, women and birthing persons, have those basic foundations of good health, and then are able to help their children develop that strong brain architecture. So, I think one of the things we've also heard in focus groups is that women feel really isolated, and past informal organizations may have provided them with support, but are not in place as often. And our community has seen a lot of in-migration and a lot of growth. And so the networks of extended families that may have been in place for prior generations are not necessarily in place now. So these are some challenges that we're identifying them. We're trying to figure out how to come together and really address them. Well, we don't want anyone in our community to feel alone. And so it's really important that we let people know that there is a way forward together. And so what our community comes behind is we say, when you feel like you really need help, there is a place to call. We advise people to call 211, and there are trained counselors who are right here in our community that are answering those phones, and they can direct people to resources in our community to help them get help. I'm so glad you're asking about this, because I think there are a lot of different strategies we can use. And here in Frederick County, one of the things we really wanted to tackle right away is the health disparity that African American women face when it comes to pregnancy complications. And what we saw is that we're really concerned about reducing the stigma associated with, getting help. And we've seen a lot of programs that are highly targeted. So we've identified that it's really important to take a universal approach and offer services that may be tailored for people to meet people's needs and really be able to meet their needs where they are, but also are available to everyone. So that's one of the things that we're working on here is a universal newborn home visiting program provided by a nurse from our local hospital. So that's one thing I think that's really important. But I think another component of that that's really important as well is to make sure that that communities of color feel that they can see and have relationships with professionals that are culturally literate, and that they see people who are from their community who are practicing. And I also think that one of the things that we saw, as I mentioned in the public survey, is a real concern about women feeling that they are perceive that they're experiencing racism and discrimination. And we can't ignore what the load of that stress does in the body, right? Over time, that's a load in the body of stress that is borne repeatedly by African-American women, immigrant women, and that takes its toll. And it really physically weathers the body, advances aging. And that phenomenon may not be well understood by healthcare providers. And it also we definitely need to do something to change that. So I'm really hopeful that this opportunity we have to try to take a universal approach, combined with also really helping put, really taking a strengths-based approach with women and birthing persons and their families to help them decide to chart the way forward for their own families with their new babies, combined with shifting the interactions, shifting the experience for African-American women, Latino women, all women and birthing persons when in their interactions with the healthcare system. I'm really hopeful that we can achieve that intersection.